Welcome back. Yes, talking about COVID-19 and some attendant matters. We've got Dr. Mukhtar Mohammed, who is the National Incident Manager for Presidential Task Force on COVID-19, who joins us via Zoom. Good morning, and thank you for joining us today on the program. Well, if I could just start off from, one of the much talked about matter, which happens to be the signing of this law by the president, and just going through that yesterday, that we did. But if you could talk to us about this, I know that the information is out there. The PTF did express a lot of frustration as to how those protocols were not being complied to as much as they would like to see, to the extent that it will prevent a lot of unnecessary spread, not that there's any necessary one, of COVID-19. Just thinking, was the PTF, what kind of role did they play? Were they the ones who suggested, look, we need to come up with a law to ensure that this compliance happens across board?
Thank you very much. Good morning, Chamberlain, and good morning, viewers. Thank you for having me on this program. You're absolutely right. We have had some level of frustration regarding the level of compliance to COVID-19 protocols in the country. We know that not only in Nigeria, but in almost every country also, there is some level of enforcement that is made by government, and also to ensure that people actually do this, follow these protocols and follow this compliance. This is not really with the intention of trying to put people under pressure, or for the government to destabilize or put some undue pressure on people. But really, it is for the public good. It is to protect individuals, to protect communities, and also to protect Nigeria as well. So PTF really played a vital role in initiating this discussion. It is not only PTF, but we had extensive discussion with state governors also. It will interest you to know that the PTF regularly interacts with state governors regarding the state of COVID-19 in the country. And it is from this discussion that this enforcement issue evolved, and it was developed, and the president signed and accented to it.
So the regulation is out now. We had one for 2020, yes, by the way, where the president ordered lockdown, as it will seem, in Lagos, the FCT and all. But in terms of communication now, we had a conversation with Professor Tomori yesterday, and he was talking about persuasion instead of this sort of regulation, that persuasion would achieve much. Based on the feelers you've gotten from people, do you think people are excited, or people are looking forward to be a part of this regulations which have been put out? Because, you need people to win this fight against COVID-19. So what are the feelers you're getting?
So the feelers, actually, you'll agree with me, even from you, the media. We've had several questions at the weekly Presidential Task Force briefing. Journalists have always asked us, when are we going to start enforcement, and PTF going to start doing this enforcement? We've had it also from people that you have interviewed on different platforms, people asking that there needs to be some level of enforcement. We were a little cautious and circumspect in trying to come out with this law, because we know that the current provisions on ground, can be legally challenged if we don't take due consultation and also follow the due process. So even within the public, we've had people reporting. We have an email where people report to say that this public place, this church, these places, people don't wear masks. The people come out and interact publicly. We have had people who complain from as far as Port Harcourt about public transportation, where the owners of the vehicle actually did not observe social distancing and everyone was not wearing masks, and they traveled all the way down to Abuja. So I think it is coming from all directions. We know it is the right thing to do, and I think the public also, those that understand, believe that we need to do something. However, as you rightly mentioned, the experience from the previous lockdown is not something that is good. We are fully aware of the economic and social difficulties that Nigerians have come to experience during that period. And therefore, we would not really want that to happen. And also, when we talk about enforcement, there are multiple steps. First of all, we have to amplify our sensitization, make sure that people are adequately informed, make sure that the communication reaches as many people as possible, and then we will start putting pressure and persuasion before we start making the prosecution. So it's going to be step by step.
Well, Doctor, perhaps a good place to start would be even the law enforcement agencies themselves, because according to the regulation, the lead agency of the enforcement, according to the president, assigned in that protection regulation is the police. And if you look around, many people, I'm pretty sure that some of them are going to put some tweets on our handle right now, that they would tell you that some of the people who are supposed to enforce these regulations themselves do not live by them. They don't wear the masks. They don't, and there was a viral video of a customs officer who refused to wear a mask in public and was trying to attend to someone. And the person said, until you wear your mask, I'm not going to attend to you. And of course, it became an issue. So then the question would be, how government agencies themselves, officials of government, how are they internalizing this, the whole idea of wearing masks, observing these NPIs, as the medical profession tells us? So question to you then, as National Incident Manager, would be, what kind of conversations are you having with ministries, departments, and agencies so that people can see that the leadership is complying, and consequently they themselves should follow? Because the people see people like the police and the rest of them not wearing these things, it sends some kind of signal, don't you think?
Yeah, absolutely, you're right. We have taken, at least a snapshot of what is going on in the town. We have visited ministries, parastatals, we have visited public places, we've gone to the markets. And certainly, yes, only few people you will observe wearing masks, and only a few public places you will see where there is some level of enforcement, at least during the temperature check, and also turning back people who do not wear masks. But even the places that were doing this, some time ago, now if you look at it, they have actually relaxed that enforcement or persuasion that they are doing. So yeah, you are absolutely right. But they say charity begins at home. Therefore, with this regulation now, we are taking our conversation up with security agencies. They are aware of the role that they are going to play. And certainly, when you are responsible for enforcing a particular law, certainly you yourself have to come clean of it. So we're having this high-level discussion with security agencies. We're taking it with different ministries. And as a rule, even that communication has been provided. You are aware that we have reduced the number of staff going to the ministries. We've directed all ministries to also ensure that they institute these temperature checks at the entrance of their ministries. We've also instructed them that no mask, no entry policy should be enforced in all government offices. And we are working with the state governments as well to ensure that this evolves. So it is really a gradual step, but surely we're going to get there.
Still staying with the federal government and the ministries that you talked about, it'll be good to find out from you what kind of communication you are having with those ministries. Because in about 11 days from now, the deadline for people to get their national identity numbers will end. And as we speak, you can almost guess what the lookout is at the various NIMSI offices all over the nation, all struggling to get their name to beat that deadline. So what kind of conversation would you say is going on with such a ministry as that in charge of communication and digital economy, who put out this deadline? One would wonder if there was any kind of conversation or consideration of these regulations that you have put out.
So actually, the problem, we have discussed that issue and we've had that conversation with the Ministry of Communication. The problem really is not about the deadline, and it's not more of the NIN registration itself. It is about the frenzy and the disorderliness that has been reported in most places where this registration is going on. The regulation we've provided is that, yes, the NIN registration is very vital, it's very important to the security of this country, which is of paramount importance. However, it can be done under COVID-19 protocol. We have talked to them, and we've talked to also the places where this activities are carried out, that people must wear their mask and there should be some social distancing. In some of the places, really, you can see that they are trying to observe it. But I think it is the pressure, the deadline approaching, and people getting anxious, that makes the places to be rowdy and to cause that violation of the protocol. So we encourage them to ensure that these protocols are implemented in these places, and they provide more points where these services can be provided, so that Nigerians do not have to break the protocol and put themselves at the risk of getting infected.
I think that last point you made was the main issue, because what our reporters saw at different parts of the country is not just about the anxiety of them wanting to meet the deadline, but the inadequacy of registration points that they were. They didn't have enough. And then if you're given that deadline and people don't have where else to go get it, people have been chasing this for years. And so they need to sort their own end out. But now that these regulations are out, we'll be looking to see how they conduct themselves moving forward. But when you talked about having a conversation with the states, that they seem to be on the same page with you on this one, could you share with us, if you can, what is it about, because we know we don't have a perfect, or at least the kind of transport system in the country that we'd like to see, in terms of that organization, such that they can observe all of this, because in some states have said it's going to be challenging enforcing this thing in that transport sector. Did they assure you, the states, that this can work?
Well, they have all previewed the regulation. They have all looked at it and edited. It is after we've circulated to all the states that this final document was now submitted to Mr. President for accept. So I'll say they are aware of the contents, and from the discussion we are having, the states are totally along with us. We know that there may be very level of enforcement or even level of conviction regarding the measures or the intensity of the measures that need to be taken in public places. But you'll agree with me, we have to start somewhere. If you look at the number of cases that are coming from Lagos, Abuja, Kaduna, Plateau, and some other states, really that is not acceptable. The virus is really going around. It is really becoming more and more, the transmission rate is becoming much higher. The hospitalization rate is becoming higher. Mortality we are getting from this COVID-19 is becoming higher. We are putting our vulnerable population, at a very high risk. And for any responsible government, we have to take serious steps to ensure that Nigerians and the public in general are protected and are not really at any increased risk of getting the infection.
Yeah, much as we'd like to see that reduced, but could you share with us, I mean, what's the scenario that, the PTF and then the drafters, what did they visualize in terms of implementing this in our markets in the country?
Absolutely. So actually what we visualize is that, number one, we do not want to close markets. And for now, we do not even want to reduce the number of market days as was done during the first phase of ease of lockdown. We want our economy to work. We want people to earn their livelihood. And we want economic activities to continue. But this has to be in a regulated fashion where we do not provide an increased risk for people transacting their businesses. So certainly we would want to see a market where before you enter that market, your temperature will be taken. There is somebody stationed there to measure your body temperature. If your temperature is above 38 degrees centigrade, you will be turned back or advised to seek health assistance or linked directly to where you will have a test done. If your temperature is negative, then they will also ensure that you have a face mask, which is actually the first thing. If you don't have a face mask, you will not even be allowed to come near the gate of the market. And then people can now go into the market, transact their business, and then come out. And we also envision to see where the market authorities themselves become responsible. They ensure that all these measures are put in place and people that are not complying are quickly reported or taken out of the marketplace. And we also want to see the law enforcement agencies working side by side with the necessary stakeholders. So in this case, the market associations or the market regulators, to ensure that these protocols are complied with. Where we have places where these protocols are grossly violated, then the law enforcement officers know what to do. If we have people who are not wearing masks despite all these measures, then they are liable to prosecution or to fine. This is the vision that we want to see, and not only the markets, but all public places. This includes supermarkets, event centers, parks, and so on and so forth.
It's quite interesting you say this is what you envision, because when you talk about, those regulations for public markets, I mean, you wonder, is it for supermarkets or the mile 12 kind of markets, the everyday markets? But like you said, it's something you envision, and we should actually work towards that because that is the minimum standard. But you talked about enforcement, enlightenment, and I'd like you to elaborate on that if you can, because we need to understand the timelines. Because for a lot of people, they think, is a regulation in operation yet? When will it come into force? But since you say that there will be some sort of enlightenment, communication before enforcement, one wonders, how is that going to work? So are you saying maybe for the next 1 month, you will do some, enlightenment and communication campaigns so that people will know what this is about and what is expected of them before enforcement kicks in? So help us understand the timeline.
Well, when you have a regulation that is signed, certainly all government agencies would work towards seeing the implementation of this regulation. But each state is going to take its own process and move it forward. And like I told you, it is not that today people will start being prosecuted. It has to be step by step. The initial, activities will involve what we are doing now, which is communicating this regulation to the public, and which is being taken at a very high level now. And also to commence this persuasion process. So people will now be certainly, asked, where is your face mask? Please go back home, get a face mask before you come out in the public. So these are the gradual steps that are going to start, and each state may probably set its own timeline. But for us in the PTF, we're just working with the states to ensure that people understand the process, the law enforcement agencies themselves understand it, and to ensure what is really of importance to us is to ensure that this process is actually implemented in a very professional manner, so that we do not have any abuse of the process or people taking advantage of the process, and to ensure that the public also understands the reasons behind this protection, health protection regulation.
Okay, if we could just do this, quickly. I want you to also talk on the lockdown. I mean, you began by speaking to that. So there's a lot of talk about whether there will be a lockdown or not. And I just want to know what is the thinking in the PTF regarding that, because we've had almost a year, 11 months, to gather data about the infections, the trends, and what have you. So I'm just wondering, rather than have a blanket lockdown and say, well, we have a national lockdown or a statewide lockdown, how well have you been able to use data gathered such that you know that, okay, these are the kinds of people that are prone to spreading it? Okay, maybe people in middle-income areas or low-income areas or high-income areas, or people that work in enclosed spaces, or people that work in markets, such that we can have targeted lockdowns other than a blanket lockdown. And I know you've had a meeting with some, data organization in recent times, but how well are we using that data such that we actually act based on data?
Okay, so actually that is exactly what we did. We have been analyzing the data, and we've been looking at the geographic areas that have been affected. We've been looking at the different age groups. We've been looking at the professions. And certainly, as you mentioned, even if we are going to have a lockdown, it's not going to be a total national lockdown. Just a couple of weeks back, we looked at the data and we identified the hotspot LGA. So we look at the country by local government areas. Mostly the areas affected are the urban areas, the urban local governments in Lagos, in Abuja, in Kaduna, Plateau, and even in most other states, it is the urban LGAs that are involved. So if we're going to have any restriction, it will be it will be more emphasized in these areas. And even with this health regulation, now the enforcement we're looking at, it will vary in severity. And certainly the urban areas are the areas that are most affected. That is why you have most of these super spreader events. And that is where we are going to target. So we've actually analyzed that, and we're advising the states also based on the data that we have, that these are the focus areas where this transmission is more than in others.
Well, Doctor, one issue, of course, that the whole world is looking at now to solve this problem permanently or as significantly as possible is vaccines. And conversations have been ongoing about that severally, about our capacity to store, our capacity to procure, and so many other issues like that. Just exactly where are we on that one? On the one hand, procurement. On the other hand, communicating it to people for people to accept, to take it, because, that's also a big issue. Tell us about our progress on that so far.
So certainly we are preparing. All government agencies have been mobilized, and they are working day and night to ensure that Nigeria is prepared for the vaccination. But that is not to say that, all efforts are only on vaccination. Our most important effort is on the containment, like I mentioned, containment and also mitigation. That is to prevent the spread of the infection, and also to ensure that those that have been infected have been adequately isolated and been taken care of. So the vaccination, certainly it is going to come, and it is really the current age discussion in the COVID world. And Nigeria is actually doing its best now, trying to ensure that we secure enough doses for Nigerians, and also working towards ensuring that our storage capacity is improved. But most importantly, communicating this message to Nigerians. In your preview, you mentioned about the meeting yesterday with northern religious leaders and the traditional leaders. So these are the sort of activities that we have focused on to make sure that people who have a voice in the community actually understand what we are doing. Because it's very important to have both political, religious, traditional, and whatever leadership you have galvanized in this direction. For people in the first place to understand where we are.
Dr. Mukhtar, sorry to jump in, but we need to wrap this up. If you can do this in about 30 seconds, could you tell us when are we receiving the first batch of the vaccine, and are you looking to, is it going to be mandatory for everybody to be vaccinated?
Yes, so our intention is really to have we have profiled people, and we have what is the first priority group. It's like the medical health workers who are the frontline health workers. They are the first priority to get the vaccine. And we hope, based on what we have been communicated to, that we are likely to have the vaccines before the end of this quarter, before the end of the first quarter.
Is it going to be mandatory for everybody to take it? I didn't get that part.
Well, there are certainly going to be exceptions, people that have conditions that will not allow them to take the vaccines. But our goal is really to target 70 to 80% of Nigerians to be vaccinated.
All right, then, Dr. Mukhtar Mohammed, National Incident Manager for the Presidential Task Force on COVID-19. Thank you for your time this morning.
Thank you for having me. Good morning.
All right, then, we will be back and focus on our next subject matter in a moment. Stay with us.